Good evening and welcome to Doctors on Call. I'm Dr. Ruth Westra from the Department of Family Medicine and Community Health at the University of Minnesota Medical School, Duluth. I'm your host for tonight's program on infectious disease and immunizations. We're glad to take your questions on influenza, flu shots, immunizations, and infectious diseases. The success of this program depends on you, the viewer, so please call in your questions and we'll do our best to answer them on the show. The numbers to call are at the bottom of your screen. Our panelists this evening are Dr. Paul Sanford, an internal medicine specialist with St. Luke's Internal Medicine Associates, Dr. Kevin Stephan, an infectious disease specialist with Essentia Health, Duluth Clinic, and Dr. Steve Tekippe, a family medicine physician with a Gateway Family Health Clinic in Moose Lake. And we have some of our medical students here volunteering to answer the phones tonight. They are Nathan Guimau from Nowthen, Minnesota, Katie Howell from Faribault, Minnesota, and Brittany Vaplon from Kellogg, Minnesota. And now on to tonight's program on infectious diseases and immunizations. So while we're waiting for the questions, maybe we can talk a little bit about influenza and flu shots. So Dr. Sanford, maybe kick us off. Is it time to get a flu shot?
Yeah, they're available now. You can get them at major drugstores or at your primary care clinic or a specialty clinic. I don't know if there's any influenza A in North America yet. Dr. Stephan will probably be able to tell us, but
we're not seeing any big surge yet, but it's definitely time to get it because it's right around the corner.
Yep, so get it now and get it often, or just once, and be prepared for January, February.
That's usually the most common time, January, February, Dr. Tekippe?
Right.
For influenza.
Yeah, absolutely, but it can happen really any time, and so the important thing is to not wait until there's an outbreak. We've seen some influenza A, like Dr. Stephan had mentioned. We do see it. It's just not an epidemic or anything at this point, but get it early and be sure that kids get their flu shots. It's really important. That includes babies older than 6 months, and pregnant women, especially even during their pregnancy, it's extremely important to get the flu shot.
I'd also like to add that there's actually a lot of information out there now about protecting vulnerable people in the community, people who are living with significant medical illnesses or the elderly. And by the young, healthy people getting vaccinated, not only do you avoid losing time away from school, work, or activities, you also are actually protecting the people who are vulnerable and that matter to you and your family and in your community.
That's a great point. I think that's part of the reason why physicians get immunized.
Absolutely.
And people think it's because we're protecting ourselves from all the illness that we see, but actually it's more importantly we're protecting people that are immunocompromised or aren't able to mount an immune response. And a single person that has influenza can certainly spread it quickly even before symptoms are noted.
Yeah,
I know a lot of patients, I offer them the influenza shot and they'll tell me that they get sick from the influenza shot. So Dr. Sanford, you want to have comment about that?
Yeah, you might get a little local red reaction to the shot, but I've never seen anybody get influenza from the influenza shot. But we have seen, how many tens of thousands of people a year that die nationally from influenza. It just shouldn't happen.
These are preventable deaths.
Yep.
The vaccine is safe. There's the inactivated vaccine. You physically cannot get influenza from the inactivated vaccine because it's not a living or replicating virus. You can get some symptoms, a little achiness or perhaps a little bit of a low-grade temperature. If somebody gets a true full-blown illness after the flu shot, it was very likely that they were already infected with something that was incubating at the time they happened to go in and get the vaccine because we're vaccinating oftentimes right through the flu season.
Mm-hmm.
And some of the local reactions that you see, like Dr. Sanford had mentioned, that's a good sign that your body's working on developing immunity. And so what people sometimes liken to illness are actually, it's not illness, it's your body working to form antibodies and activate the immune system so that when it sees the actual flu virus, it's able to take an immediate response and hopefully prevent it.
Yeah. Dr. Stephan, just talk a little bit more about influenza as I read the questions here, but what symptoms, if you didn't get the flu shot and you are exposed, what would you present with symptoms of influenza?
Well, I have an awful lot of people who casually throw the term flu around and they say, yeah, I got the flu, and they talk about gastrointestinal upset, or they talk about a little bit of a sniffle, or they talk a little bit of a headache or sinus congestion. Once you've had the true influenza syndrome, that's a strong incentive to get immunized in subsequent years, because most people can say they can look at their watch and they can tell the hour that they were becoming sick with it. It literally hits you like a train. High fever, typically 102, 103, even higher. Headache, muscle aches. It's up to the point where your clothing can even hurt and you just want to go lay in a dark, quiet area. Cough, respiratory symptoms. It's a pretty severe illness, and the average person will lose 3 to 5 days away from work or school, and then take up to a week or more to feel better after that. So it's and as Dr. Sanford pointed out, we have mortality. The very young and the very old, especially those with immunocompromising diseases, but we can have up to 40 to 50,000 deaths a year with seasonal flu, and even more if there's an epidemic version.
Pretty significant. Dr. Tekippe, you mentioned pregnancy and getting the flu shot. Is there a timing during the pregnancy? Somebody's calling from Duluth asking about that.
I think the newest recommendations are that you can get the flu shot anytime during the pregnancy. The worst thing that can happen is not getting the shot during the pregnancy. They found that actually pregnant women are one of the highest mortalities from the flu. And so please get your immunization. It's just so much safer than not getting it. People worry about things like, are there going to be problems with the baby? Well, if the mom has complications from influenza, the baby will only suffer. And so do get your flu shots, so important. The other thing with pregnancy I should mention is that a newer recommendation came out that now, because of because of pertussis or whooping cough that's out, they are recommending now that all women do receive your DTaP, which is diphtheria, tetanus, and acellular pertussis during the pregnancy also. I believe that's in the 3rd trimester. They would like to see women get that. Be sure to do that. That's we see a lot of that's to protect the newborn baby, even more than the mom. And those are some newer changes.
Yeah, and actually, I think grandparents, they'd like to have grandparents, anybody directly related to the newborn at that time. So Dr. Sanford, continuing just with flu for a little bit longer, the controversy about the content of flu shots, that's sometimes why people are hesitant. Is there a problem with that?
No, unfortunately there are a lot of well-meaning people who believe that vaccinations actually cause autism and other illnesses. They don't. All of these claims have been thoroughly debunked. We need to be getting the vaccines, and they do not harm people.
Dr. Stephan, going to pneumonia shots. I have a caller asking, if they get the flu shot, can they get the pneumonia shot at the same time, or what exactly is that? Yeah,
the ideal is actually if you're going to get the pneumonia shot and the flu shot, getting them at the same time is convenient and it's effective. You'll get protection from both then. There are certain groups. Influenza is recommended as a vaccination basically for anybody 6 months and older. There are certain groups that are more vulnerable to bacterial pneumonia with strep pneumonia, and the vaccine for pneumonia protects against that particular bacteria for either pneumonia or what we call invasive pneumococcal disease. And there are high-risk groups, those over age 65 or those who are younger who have other conditions like heart condition, kidney conditions, immunosuppressing illnesses that should get the pneumonia vaccine as well.
Okay. And Dr. Tekippe, just to spin off that a little bit more, the Pneumovax, is it a one-time shot, or is there a repeated dose that happens with that? Right.
There's a few types of pneumonia shots. If we're just talking about the adult version of pneumonia, there's also a pneumonia vaccine known as Prevnar that's for younger children, 2, 4, 6, and 16 months of age. But the pneumonia shot can be given to high-risk patients. You have to look at the different types of patients you have. If you have somebody that's, for example, has an immune system that's not functioning correctly or is on immunosuppressive drugs or drugs that decrease the immune response, there are different recommendations for those patients. One thing that we see a lot of in the clinic is if you're over 65 or older, you only need one pneumococcal shot, Pneumovax, at that point. I think people feel like they need to keep getting them after that. Well, they've looked at that and they found that actually it can be harmful, or at least not as beneficial, to get more than one shot at 65 or older. And that's a person that doesn't have other risk factors.
That's very helpful. Dr. Sanford, people asking, I got a couple callers asking about Guillain-Barré and told not to get a flu shot.
Yeah.
Thoughts about that from any?
I think that has also been debunked. I don't know of any credible evidence that links Guillain-Barré syndrome with the influenza vaccine. Dr. Stephan, have you?
If there is a link, it's exceedingly rare. Somewhere in the neighborhood of maybe 1 to 2 million vaccinated persons. And that's hard to tease out. Is it the vaccination that caused the Guillain-Barré, or is it another viral or other infection? There's a link with certain bacterial infections, for instance, and the recovery from them that can lead to Guillain-Barré, for instance.
I think the majority of Guillain-Barré that is seen, and I'm sure all of us have seen it in different frequencies, but does not come from any immunizations. And
Right.
it's often from a virus that is later identified, or we never find the cause. Guillain-Barré is not an easy thing to diagnose.
Yes.
And by the time it is found, it's supportive treatment. And like the docs have said here, don't refuse to get a shot because of your fear of Guillain-Barré.
Or other autoimmune
That's right.
abnormalities and
Absolutely.
things. There's a couple callers asking about that too. Dr. Stephan, let's switch just a little bit to Zostavax or the Shingles shot. If you want to describe that and who would be a candidate for getting those shots.
So Shingles, of course, it's a reactivation of the chickenpox virus that most of us were exposed to when we were younger. As we get older, our immune system becomes weaker just naturally with age, and people become more vulnerable to having that zoster or that varicella zoster virus reawaken. And in adulthood, once you've had chickenpox as a child, the most common form it takes is as shingles, which is, of course, a painful outbreak of blisters in an area of your skin. Now, the Zostavax is basically that virus in a weakened form in a dose that produces additional immune protection so that people who are aging and are more vulnerable or who had an attack of zoster can get this vaccine and will provide an additional measure of protection against getting shingles.
So if you've had shingles, Dr. Tekippe, if you'd like to take this question, do you still get the Zostavax?
Absolutely. I think that, as was pointed out, the virus tends to live in the nerves, and the nerves are off limits from the immune system, the nerve dorsal ganglion where the virus tends to hold up. It hides there, and then it reactivates, and we're never sure exactly why. There are things like ultraviolet, age, and just time that can activate, or stress that can activate the virus. Then it multiplies and moves right down the nerve roots and comes out the axons, and it can be involving the skin. More worrisome, it can involve the eyes and cause blindness. It can cause chronic pain is one of the biggest complications from it. And so just because you've had the zoster rash or the equivalent of the zoster does not mean that your immune system is ready to fight it. And so the vaccine is much better at causing your immune system to gear up and be ready to fight it than actually having the zoster, which is somewhat hard to understand, but that's the nature of the immunization.
Well, Dr. Sanford, if you do get shingles, what do we do about that?
Well, as
Herpes
quickly as you
zoster?
can, get a hold of your doc as quickly as you can. Get you on some type of an antiviral agent like acyclovir, valciclovir. There are several. And the quicker you move, the better chance you're going to have of being spared terrible, debilitating pain.
Dr. Stephan, we're going to go back to flu shots again. There's more questions about that. So you're planning on having an upcoming surgery. A caller from Duluth is asking, should you get the flu shot before the surgery or after the surgery? Is it okay to have it before? Is probably the biggest question here.
Yeah, it's absolutely okay to get it before. There's no reason to postpone the flu shot until after the surgery. There's no problems with reducing the effectiveness of the flu vaccine. People are, depending on the type of surgery, maybe even more susceptible to getting certain infections in the hospital, and certainly having the vaccine on board at least a week or two before the surgery would be helpful under those circumstances.
And Dr. Tekippe, maybe just a conversation about the different types of flu shots. There's a couple callers asking about nasal
Right.
versus a higher dose for seniors.
Right. There are some differences. There's a new intranasal virus that can be given to, I believe it's 2-year-old to 64-year-olds, and that is an attenuated virus that that is very safe, and it's very effective at initiating an immune response. From my experience when giving it, yeah, I guess you'd think one of the advantages would be that it would be less painful than a shot. The nose is very sensitive, and I've just found that the children that we give the nasal to, I found that sometimes it scares them. It's kind of a rapid bolus into the nose. Very effective. I don't want to shy anybody away from it. I just thought it would be a little more tolerated than it is. So I've had quite a few patients that have just opted for the main shot, the shot with the covering for influenzas and in one. Then there's they found that people that are older tend not to form as much of an immune response to it, so they've actually increased the potency of the vaccine. And so 65 and older, they get a different shot, and it's more powerful. It tends to stoke the immune system a little bit more to try to offset some of the immunity that the responsiveness to our immune system that we find happens as you get older.
It's probably the quad shot they were asking
Yes,
about. Yeah. Dr. Sanford, what combinations of shots can you get together? Here's a person asking about flu and shingles. Can they get those together? Do you have to have a timing? What's the timing of shots?
Typically, we'll give flu and pneumococcal vaccine together. Shingles shot tend to give at a separate time because it's a living attenuated virus. Probably practically is not a big deal to give them all at once, but we tend to just have them separated.
General rule of thumb is that flu and pneumovax will tend to put together. They're both occurring in the respiratory infectious season, and it's convenient if somebody's in your office. You have a moment where they're in front of you, and you can offer them both vaccines, and then you know they've gotten them. And again, a lot of times the Zostavax, as a live attenuated vaccine, there can be there's theoretically some concern about not having as robust of a protection if you cluster the vaccines that are live and attenuated with the inactivated ones. But it's probably, that's maybe overstated too.
I think one thing we might want to point out is the age for the Zostavax to be given. And I believe it's 60, but it can go down now. They're looking at 50.
Mm-hmm.
And so, some people, depending on your insurance carrier, what they cover, some are right on that and will cover at age 50, some don't. And so at least where we are, actually our pharmacy gives it for us there, and that's been really efficient. They're able to run the insurance card through and see what's covered as to how much they'll charge, and they can give it right at that time. And then the other important thing is any of these immunizations that are given in Minnesota go into the registry. And that's very important, that wherever you get your immunizations, be sure you ask them, whoever you're going to get them from before you get them, whether that information goes to the Minnesota registry so that we know what immunizations you have received. It's not mandatory, it's voluntary whether you'll enter the Minnesota registry for immunizations. But it's such an important program, especially for children, as they move around a lot, and I think that we'll see that nationally, and I'm sure they've worked on that.
I think that registry is very helpful, especially you're doing sports physicals and they don't remember their immunizations. That eventually will help us quite a bit.
Right, and then they shouldn't have to. I mean, and it's really helped us from getting calls from the schools. They can enter the registry and they can look on the registry, and they don't have to call the clinic and the doctors and say, can you submit this form? It's all right there. And boy, that's been a great registry.
Well, I have a caller, just to spin a little differently. I have a caller from Duluth asking about antibiotic resistance and are physicians prescribing less antibiotics. Just that's a general infectious disease question, but what do you think, Dr. Sanford?
Well, I think that, as a group, physicians are much more cautious about over-prescribing antibiotics. In the good old days, Marcus Welby would give everybody an antibiotic for a sore throat or sore ear. Now we really want to have true objective evidence of a bacterial infection. And it's true, there are multi-resistant bacteria. Some of them are extremely scary. And a lot of antibiotics don't degrade. Ciprofloxacin and the other fluoroquinolones go into the water table, and they stay in the water table. They do not break down. And so we do have to be more judicious about how we use antibiotics.
Dr. Stephan, cancer. patients. I have a couple of questions about people with cancer and whether, with chemotherapy and that type of thing, they should be receiving flu shots are predominantly what they're asking about.
Yes. Now, if they're actively receiving chemotherapy, they should not get the live attenuated version, because that is a living virus, and there's a theoretical concern that they could get sick from the vaccine, although it's rare. But it is recommended that people getting chemotherapy or other reasons for having their immune system to be suppressed would get the inactivated version, and that's safe and effective. But the high dose would probably be advised in those people as well. Same with the elderly.
Dr. Tekippe asking about they never had chickenpox. Should they get Zostavax?
Yeah, that's a great question. Again, I would look at the age. When you look at the incidence of true chickenpox, it's one of the most infectious diseases known to man. In fact, if you put two groups of people with a cement wall in between and one has chickenpox, I believe it's over a 90% conversion rate. People will get it. It's a respiratory virus. And so if you did run, people that say they've never had chickenpox, they may not remember it, or it may have been a mild case. If you were to run the serology to see if they did have exposure, the majority, well over 90%, would have chickenpox throughout their lifetime. So yes, I think if you hit age 50, I think is the newest recommendation for that, you definitely should get the Zostavax. And that's more cost effective than testing to see if you've had chickenpox, because the odds are you definitely have at least been exposed, and it's hiding there in your nerves.
Hi, Dr. Sanford, here's a question, different immunization, meningitis.
Sure.
What is our protocol for injections or immunizations for meningitis?
Yeah, meningococcal vaccine is very important, especially people who live in military barracks, colleges, where you get an outbreak. You want to jump. If there's an outbreak of meningococcus, then everybody needs to be vaccinated. It's more important than eating a cheeseburger. Very important.
Mm-hmm.
Very much.
Yeah, the recommendations are actually that pretty much unique. All children kind of in the teen years get the vaccine. If they have it before the age of 16, they should get a booster before they go off to dormitories or military or other settings where they're going to be living in close quarters. But every year I take care of some people who are devastatingly ill with meningococcal meningitis, and it's much better to prevent than to have to treat.
And the other forms of meningitis, pneumococcal meningitis, that's why it's so important to have your baby vaccinated too, and your young children. Pneumococcus and H flu, two things that we don't see much anymore.
Right.
Thank God.
Right.
I'm sure.
It's scary though. We're seeing diphtheria,
Right.
whooping cough, things that shouldn't be around.
History repeating itself.
Measles.
Well, that's right. And
Yeah.
a lot of it is immigration and travel, and we're going to see those things again, and
Yeah.
history always repeats itself.
It's too bad.
And we've learned our lesson through history too, that when you let your guard down, history repeats itself.
And quickly, yeah.
Yeah. Devastating.
Well, one more quick question about egg allergies. That seems to come up a lot. A flu shot. Dr. Tekippe, will let you take this one. Associated with egg products?
Yeah, I think it's important to really document and find out exactly what kind of allergy they have. And some would even recommend actually being skin tested to determine whether that's the case or not. I think I hear that a lot, but I don't see all that much true egg allergy.
Right.
And allergies change over time, and a lot of times you all grow allergies. So I think it's important to give a good history and ask your doctor about, are there some testing that could be done, because not getting a flu shot because of a presumed or assumed allergy is a real pitfall for patients.
For patients, yeah, it is. Maybe one more thing about the shingles shot. How long is it good for? It's a one-time. Dr. Stephan, if you want to take that one.
It's recommended as a one-time boost, and the immunity will probably fade a bit over time, the protection that you get. But most of the people who are getting it are over the age of 60 or maybe over the age of 50 if their insurance covered it, and it's the hope that the natural immunity they already had from having had childhood chickenpox plus the boost they get from the Zostavax is going to carry them through and greatly reduce their risk of getting a bad case of shingles.
Any last words of advice for patients or callers now? We're almost done.
Well,
Eat your vegetables.
I'd like to say don't be afraid of vaccines. They've been proven. There's a track record. They're well tolerated. They're safe. We don't want to see a return to the pre-vaccine era when children were dying of illnesses that are easily preventable or having complications from them. Cover your cough and wash your hands.
Yep. I would just also add to that there's nothing that we do that even comes close to being as cost effective as giving immunizations, and I'm talking thousands of folds.
Amen.
Valuable. So if we just spent all our time as physicians giving the immunizations, we would do more good than trying to treat these illnesses. And when someone's not immunized, they put themselves and others at risk. So I think really important to get immunized. And I know some physicians won't be able to keep the patients if they won't immunize their children.
Yeah. Well, very good. Thank you so much. I want to thank our panelists, Dr. Paul Sanford, Dr. Kevin Stephan, and Dr. Steve Tekippe, and our medical student volunteers, Nathan Guimont, Katie Howell, and Brittany Vaplon. Please join Dr. Alan Johns next week for a program on diabetes, when his panelists will be Dr. Dave Hutchinson, Dr. Ken Ripp, and Dr. Michael Slag. Good night.